let's take a little bit of time and look at this subject of acid-base balance. Acid-base balance is a critical information to have when you're taking care of patients. And we're going to just touch on it when you get to your clinical rotations. I'm sure you will go into things in much greater detail. But I did want you to understand a few things about acid-base balance. One thing, unfortunately, is that we refer to the amount of acid in the body not as the number of milliequivalents per liter, but rather as a pH. The pH scale is a logarithmic scale, and without getting into the math, just remember that the lower the pH, the more the acidity. Can everyone say that? The lower the pH, the more the acidity. One more time. No, I'm serious. All together. The lower the pH, the more the acidity. All right then. So a normal pH is 7.35 to 7.45. Acidosis, a condition in which the body has excess acid, is defined as a body pH of less than 7.35. Alkalosis, on the other hand, a condition in which there is not enough acid in the body tissues, is defined as a pH greater than 7.45. And I'll expect you to know these terms. So where does this acid come from, this acid that we're so interested in controlling? Well, it turns out that we make acid in our bodies all the time. So our metabolic processes, as you see here, when water combines with carbon dioxide to make carbonic acid, the net result of that is the formation of a hydrogen ion, and a hydrogen ion is indeed the acid in the body. So also metabolism of various substances, fatty acids are acids, certain amino acids are acidic, and so on and so forth. So our problem is that we make acid and we must keep our acid-base balance between those levels of 7.35 and 7.45 in order to maintain homeostasis. And the body has three ways to do that. It has a chemical buffer system. You can use your respiratory system, and the final arbiter of our body pH is the renal system. So let's just take a brief look at how that works. A buffer, for those of you who have not had chemistry, and perhaps as a reminder for those of you who have, a buffer is a system that resists a change in acidity by either soaking up acid or giving off acid. And here we see the carbonic acid system acting as a buffer. So if there was excess hydrogen ions, it could combine with bicarbonate to make carbonic acid. And now that free hydrogen ion is no longer in the body fluids, and that reduces the acidity of the body. That same molecule can, if needed, give up a hydrogen ion. So if there's not enough acid, the carbonic acid molecule can dissociate to form a hydrogen ion and a bicarbonate ion. And now you see that the same substance can either take on hydrogen ions, which would reduce the acidity, or it can give off hydrogen ions, which would increase the acidity. And that's a buffer, quite simply. So once again, the carbonic acid system can either give off a hydrogen ion or accept a hydrogen ion. Also, this same system can be used to reduce or increase the acidity in the body using our lungs, the respiratory system. So, for example, let's just rearrange that equation a little bit, take a look at it here. So this is a chemical reaction. And in a chemical reaction, you have certain molecules combining to form other molecules. And the dynamics of this reaction tell us that if we add molecules to one side of the equation, we'll push the chemical reaction towards the other side. So here, for example, if we added excess hydrogen ions on the left, that would push this chemical reaction to the right, and we would make more carbon dioxide. Well, what can we do then to get rid of that excess carbon dioxide? Yes, exactly. We can breathe more rapidly. So you can blow off the excess carbon dioxide, and in doing so, you will reduce the acidity in the body. You can, right now, if you wish, hyperventilate. If you breathe deeply and rapidly for a few moments, you'll see that you start to get a little dizzy. Why is that? Well, that's because if you breathe rapidly and you blow off your CO2, this chemical reaction will move to the right, and the normal acid content in your body will go down because you'll be using up that excess hydrogen ion and pushing the equation to the right. And so your pH will then go up. Yes, remember that the lower the pH, the more the acidity, and vice versa. So in this case, when the acid content is too low, the pH goes up. And that will cause alkalosis. And alkalosis can and usually does cause a reflex decrease in the blood flow to the brain, and so you begin to feel dizzy. Similarly, what would happen, and here's a very common clinical situation, what would happen if, for some reason, you were not able to ventilate? Let's say that you're having dinner, and the fellow behind you, a loud, boisterous guy, has had too much to drink. And he's eating a big, thick steak, and he's telling a story, and all of a sudden he stops telling the story, and he puts his hand to his throat, and he turns very, very red. And what's happened to him, of course, is that because he's had too much to drink, and because he probably cut a very large piece of steak, and because he was talking and eating, that piece of steak has wedged in his trachea. And now he cannot blow off his CO2. So the CO2 starts to accumulate. And this equation is just like a teeter-totter. If you add more hydrogen on one end, you get more carbon dioxide on the other. And if you add excess carbon dioxide, you'll get more hydrogen ions. And that's what's happening in this case. Our diner has stopped his ability to blow off CO2, and now carbon dioxide starts to accumulate in the body tissues. As a result of that, because of this chemical reaction, his acid content goes up and his pH goes down. Now finally, we see that the renal mechanism is the ultimate arbiter of our pH. You see that the amount of acidity can be regulated by the chemical systems in the body, and we've just discussed how the amount of acid can be regulated by the respiratory activity, either retaining or blowing off carbon dioxide. And the final mechanism is the renal mechanism. And the kidneys can quite simply either excrete acid or absorb acid. So if there's excess acidity, the kidneys will put acid into the urine. If there's insufficient acidity, the kidneys can absorb acid back from the renal tubules and bring it back into the body. All three of these mechanisms are used in the body, and the timeline is very important. So I will expect you to know this slide. The buffers, the chemical systems, react in seconds or less. This is nearly instantaneous. The respiratory system acts in minutes. You can hyperventilate or hypoventilate to adjust your pH, and it will take a few minutes for you to get the pH where you need it. The renal system acts in hours. And so if you knock the body out of homeostasis, these salvage mechanisms come into play in that order. Now, we've already seen an example of a buffer system when we looked at how the body carries carbon dioxide in the blood. And if you remember, the carbon dioxide filters into the red blood cell where it forms carbonic acid and then dissociates to form bicarbonate and an acid ion. The bicarbonate leaves the red blood cell, and that's how we carry carbon dioxide back from the tissues to the lungs. But now we have a problem because every bicarbonate ion that we make, we produce an extra acid ion. What happens to that acid ion? Certainly something must be done, because if we increase the acidity inside the red blood cell, this could be very harmful to the cell. Well, what happens, we said, was it attaches to the hemoglobin molecule. And that's an example of a protein buffer system. The hemoglobin molecule absorbs that extra hydrogen ion and keeps the red blood cell acidity normal, and then when you get to the lungs, the whole process is reversed. The hemoglobin molecule gives up the hydrogen ion, and you then combine that with bicarbonate to form CO2 and water, and the CO2 is delivered out of your body by your lungs. Now we're only going to say a few more things about acid-base balance. Let's look at some abnormalities of acid-base homeostasis. Well, we've already talked about this one. What happens when the respiratory system fails? For whatever reason. Could be that fellow sitting behind us in the restaurant with the piece of steak wedged in his trachea. Or it could be that someone is unable to ventilate for a variety of reasons. Perhaps they have pneumonia, and pneumonia prevents the exchange of carbon dioxide, knock on wood. In that case, the carbon dioxide level in the body builds up, and that causes an excess of hydrogen ions in the body. And so that moves the body out of homeostasis, making it too acidic, and we call that abnormality, when the body is too acidic, acidosis. And in this case, because it's caused by the respiratory system, we call it respiratory acidosis. Respiratory acidosis is the most common acid-base disorder, and it's characterized, of course, by a low pH, because the lower the pH, the more the acidity. And it's also characterized by a high carbon dioxide content. And when you want to find out what someone's acid-base status is, these are some of the things that you measure. You measure their pH, you measure the carbon dioxide content in the arterial blood, and you measure the base content, or the bicarbonate content, in arterial blood. What happens when the respiratory system blows off too much carbon dioxide? Hyperventilation. This can happen clinically because someone gets excited and anxious and afraid, and they breathe too rapidly, and as a result, they blow off their carbon dioxide. When that happens, this chemical reaction moves from the right to the left, and the hydrogen ion is used up, which means that they have too little acidity in the body, and if the amount of acidity in the body is too low, the pH goes up, and in this case, we call this respiratory alkalosis. It's characterized by a high pH, remember that would be a pH greater than 7.45, and a low pCO2, because the carbon dioxide level is what determines the acidity in this clinical case. Another case where you see this is if somebody's respirator settings are set inappropriately. If you hyperventilate your patient on the respirator, you can develop a respiratory alkalosis. And sometimes people do that on purpose because of other things going on with the patient. Now, there are conditions in the body where too much acid is made. And these conditions are lumped together in this term, metabolic acidosis. So, for example, if you are a poorly controlled diabetic, you can develop excess acidity in your blood. If you go into shock, lactic acid will build up for anaerobic glucose use, and you can go into metabolic acidosis. Crush injuries can also do this because of the formation of excess acidity. Severe diarrhea can do it because with severe diarrhea you lose excessive amounts of bicarbonate. And alcohol poisoning can also lead to metabolic acidosis because alcohol is broken down in two steps, and the first step is the formation of an acid. Now, in this clinical situation, it's acidosis, so the pH is low, and the bicarbonate level or the base level is also low. And that's the characteristic of metabolic acidosis. We've only got one more to go, and here it is. Metabolic alkalosis. So, metabolic alkalosis is a condition in which there is excessive bicarbonate due to the excessive loss of acid. So however could something like that happen? Well, we just studied one place where there's lots and lots of acid formed, and that's in the stomach. So if somebody has prolonged, persistent, and severe vomiting, every time they vomit, remember, they're taking acid out of the body, and that's going to lower the acid content in the body. Acid content in the body goes down too much, the pH goes up too much, that's alkalosis. And here's a tip, it's metabolic because it's not respiratory. That sounds a little glib, but that's how it works. If the problem, either acidosis or alkalosis, is not the result of the lungs either hyperventilating or hypoventilating, we just call that metabolic. So in this case, it's metabolic alkalosis, characterized by a high pH, of course, because that's what alkalosis is, and a high bicarbonate content. And that's all I have for you, ladies and gentlemen, so I appreciate your attention, and I'm sorry